This is part 2 of MedSurg 1 exam. Again, this is Cliff Roperus. 31st. A nurse is reinforcing teaching to a client who has herpes zoster. In what order should the nurse identify the typical occurrence of findings? Should be paresthesia, redness and swelling, appearance of vesicles, whipping blisters, and clustered lesions. That will be paresthesia, redness and swelling, appearance of vesicles, whipping blisters, and clustered lesions. You are reinforcing teaching to a client who has herpes zoster. The nurse should include which of the following statements in the teaching. Recurrence of infection can be triggered by stress or trauma. Recurrence of infection can be triggered by stress or trauma. You, as a nurse, is collecting data from a client who has herpes zoster or shingles. Which of the following is unexpected findings? Painful vesicles following a nerve pathway. The answer is painful vesicles following a nerve pathway. You, as a nurse in a provider's office, is caring for a client who has tinea pedis or athlete's foot. Which of the following findings is expected to see? Scaling and redness between the toes. Scaling and redness between the toes. A patient has contact dermatitis on the upper neck and lower chest. Upper neck and upper chest. Which of the following should the nurse expect? Skin irritant exposure. Skin irritant exposure. You, as a nurse, is reinforcing instruction to a client who has contact dermatitis. The client has reported increased pruritus or redness or itching during the winter months. Which of the following information should the nurse include? Stroke the skin with the palm of the hand. Stroke the skin with the palm of the hand. You, as a nurse, is caring for a client who comes to provider's office to treat for acne vulgaris. Which of the following instructions should the nurse reinforce teaching for the client? Minimize sun exposure. Medications used to cure acne vulgaris may result in development of photosensitivity. The answer is minimize sun exposure. You, as a nurse, is collecting data from a client who has SLE or systemic lupus erythematosus. Which of the following findings is the highest priority to be reported to the provider? The answer is presence of peripheral edema. Presence of peripheral edema. SLE or systemic lupus erythematosus. A patient is taking hydrochloroquine to reduce skin inflammation. The nurse should identify which of the following as an adverse effect of the medication. Blurred vision, blurred vision, blurred vision. What are the warning signs for skin cancer? The answer is border irregularity. The answer is border irregularity. Skin disorders are common and require accurate diagnosis with a physician. Which of the following nursing actions are appropriate for skin assessment? SATA. That will be inspection of the skin inspection of the skin under natural lighting, careful health history, observe skin color, and check skin temperature. So that would be infection, inspection of the skin under natural lighting, careful health history, observe skin color, and check skin temperature. In the emergency department, it is determined that the burn victim who has full thickness burn of over 35% of the upper body and the nurse who document the burn injury is expected to see what? Dry leathery scar, charred vessels, no blanching with pressure, and black or red charred. So that would be dry leathery scar, charred vessels, no blanching with pressure, and black red charred. What is the treatment for acne? Percutane, benzoyl peroxide. Percutane and benzoyl peroxide. There are only two PPE you should use when taking care of a patient with scabies: gown and gloves. Gown and gloves when you use PPE for taking care of patient with scabies. A patient has cellulitis. What are they expected to see? Redness and swelling. Redness and swelling if the person has cellulitis. What organism causes impetigo contagiosa? That will be Staphylococcus aureus and Streptococci. Staphylococcus aureus and Streptococci. What are the signs of early smoke inhalation? Coughing, wheezing. Go to page 97. There's more. Coughing and wheezing will be part of them. There are five options and four are correct. Pediculosis capitis. Which of the following is the definitive indication for this condition? The lice. The lice would be the pediculosis capitis. Prevention of pressure ulcer. Reposition every 2 hours. Prevention of pressure ulcer. Repositions every 2 hours. This be review is edited by John. Thank you, and narrated for you by Cliff Ropres. Aha! Good luck to your tests.